Today we're going to cover sensory perception and cognitive and talk a little bit about what actually can disrupt those processes. And then we're going to bring it together as a class and talk a little bit more about sensory perception and cognitive and what factors affect that in our patients. Sensory perception is a conscious process of selecting, organizing, and interpreting sensory stimuli that requires intact and functioning sense organs, nerve pathways, and the brain. Structures of sensory perception are sensory receptors, the reticular activating system, better known as the RAS, and the nervous pathways to the brain. The RAS is responsible for bringing together information from the cerebellum and other parts of the brain with what is obtained from sense organs. Sensory perception is a conscious process of selecting, organizing, interpreting sensory stimuli that requires intact and functioning sense organs. We also need to have intact nervous pathways and the brain. So those sense organs are your eyes, ears, nose, mouth, fingers. Know the medical terms, so tactile, auditory, visual. Use the good old nursey words. So what does this mean for us? It means that many of us have the ability to sleep through the noise of a busy street or fall asleep on a plane, but the small noise made from a child will wake us up. So if your daughter sneezes or coughs in a room far across the house, you can hear it. But if there's an ambulance maybe even going out the front of the house, you don't hear it at all. It is also responsible for our ability to adapt and block out sounds of our children, such as playing, yelling, screaming when we're trying to study or pay our bills. Our senses have adapted to those sounds and we respond less and less over a period of time. And this is a natural response. Some lifespan considerations. In a newborn and infant, they require repeated stimuli for the nervous system to mature. And lack of meaningful stimulation can lead to developmental and motor delays. This is why we like to see hands-on with the mothers and their babies when they're first born. Toddlers in preschool, this is a key moment for their growth and development, and attachments are directly linked with sensory stimulation. Toddlers like to explore and learn about what they see, hear, smell, taste, and touch in their environment. So you'll see a lot of hands-on with these kids. Child and adolescents, they start making independent decisions, not always in their best interest, but they start to trial and error. Adults and older adults, their eyesight begins to diminish, sounds become more muffled, and general senses are diminished. So some factors that affect sensory perception. We become more used to our own environment, and when there is a change within that environment, or we ourselves visit another person's home where the environment is different, we may find it threatening or uncomfortable to be in. So patients that typically will live alone in a large home, to suddenly share a small room with another person in a nursing home setting can be very difficult for them to adjust to. People with different lifestyles perceive stimuli differently. Those used to a busy, noisy environment, lots of kids surrounding them, may be more comfortable in a huge family gathering. Those from a single child home with few people around them may become overwhelmed. And think about those coming in from a different cultural surrounding with very different tastes, languages, behaviors, and health perceptions. It can be difficult for them to adjust to. So be mindful of that with many of your patients in the healthcare setting. Of course, previous experiences, illnesses, medications, all impact our perception and our ability to adjust to certain environments. Think about some variations. What are some ways that we can cause sensory overload in our patients? What signs would you see of a patient with sensory overloaded? And what are some signs your patient has sensory deprivation? Think about those and we'll bring that together as a class and start discussing some of them. When we are assessing our patient's sensory perception, we want to talk to them and ask them some questions, such as what is their normal pattern during the day at home? How do they spend their day? Have there been any recent changes? What are their living arrangements? And what are their interests and habits? Now, sometimes our patients can have altered sensory perception, and this can be related to spinal cord injury, brain damage, changes in receptor organs, Could be also related to sleep deprivation and chronic illnesses. And we'll see this in many of our patients that are hospitalized. We need to be able to identify risks for our patients, so age, culture, language, medical history, activity level, medications they're on, and experience with healthcare settings. Other nursing considerations: be aware and ask to yourself, does the client have any illnesses or aging processes that have decreased their ability to smell, see, hear, or feel? Do they have a childhood injury or illness that has affected any of these? If there is a yes to any of these, safety measures need to be put into place to ensure safety for our patient and for you. Some of the nursing care we need to provide our patients: client teaching, making sure that our patients have regular checkups, close monitoring of their diabetes, avoid eye strain, appropriate lighting, infection and injury, prompt recognition and treatment of ear infections. We want to make sure that our patients are current on their immunizations, wear protective eyewear if they're in the welding department or work in a welding environment, sanding, any of those high-risk career options. Protected earwear when working in a very noisy environment, need for routine checkups, and don't delay medical attention. Compliance with medication and medical routine is important. Self-monitoring of blood sugars, blood pressures, diet control, follow-up appointments, all of these are very important. Also, too, if our patients are due to be going in for a procedure, we want to prepare our patient objectively and specifically explain to the client what he or she will see, hear, smell, taste, or feel, why the procedure is being done, when it'll be done, who will do it, and approximately how long it'll take. And of course, let our patients know that that time, of course, will vary depending on the doctor and if there's any delay times with previous procedures. We want to provide individualized care, respect, and appropriate introduction to our patients. If you have to, you may have to introduce yourself to your patient 5 times because they will not always understand or recognize that that was you. Explaining all activities, make sure that when you say that you're coming back, that you follow up and do return to that room. Show the client the equipment that's being used. If it's a child, maybe put the blood pressure cuff on a teddy bear, or show them the mask, or give them your stethoscope and have them listen to you. Give them some hands-on with that equipment if possible. If your patient has difficulty in testing temperatures and feeling temperature of water, maybe give them a thermometer and talk to them about the maximum heat of the water. You can talk to family members about inspecting food for freshness or how not to use harsh chemicals for cleaning in confined spaces. Maybe you want to educate the family on or the patient on checking their feet for any wounds, just in case they have got neuropathies. And when we're talking to our patients about cognitive processes or observing our patients, remember that cognition is a systemic way we think, reason, and use language. Our consciousness is our awareness. Attention is our ability to concentrate on and take in specific stimuli. Our memory is our ability to recall information. Learning is our capability of the nervous system to store those memories. Communication is our way of exchanging information. And comprehension is reality, perception, and orientation. Do we have a time, place, situation on your patient? Do they know who they are and where they are at? Judgment is where we process stimuli and determine meanings. And our recall and recognition is our long and short-term memory. And of course, our language is our ability to convey the needs, ideas, and feelings. And you can get more information in chapter 36. I want you to do a little bit of reading on lifespan considerations, thinking about your newborns and infants. We have their sensory motor period, their bonding, repetition and maturity, as well as nonverbal communication. With toddlers and preschoolers, there's object permanence, language and thinking, transductive reasoning, and confidence and independence is developing. School-age children and adolescents are multi-dimensions. They have learning and play environments, emotional stress, communication with peers developing. And our adults and older adults, They begin to be more creative and have more productivity at work. They have more concrete thinking, age-associated memory impairments, and diminished vision and hearing. And you can, as I mentioned, you can read a little bit more on that in your book. Think about some factors that affect cognitive functions, some physiological factors: blood flow, nutrition and metabolism, fluid and electrolyte imbalances, sleep and rest, also self-concept. You also have, many of your patients have infectious processes, degenerative processes, many medications that they're on, or they could have a head injury. And there might even be some environmental factors. And of course, culture, values, and beliefs play into that as well. So some of your manifestations you might see is disorganized thinking. They might have an impaired thought process or an altered level of arousal, altered attention, or memory impairment. And they could have impaired communication, so expressive aphasia, receptive aphasia, anomic aphasia, global aphasia, and dysarthria. Some of your assessments is you need to be able to identify normal pattern and identify any risks or dysfunction identification. We want to encourage healthy lifestyle, improve memory, maintain learning skills. You want to continue to orient and reorient your patient to their surroundings and provide alternative communication methods. There may even be environmental restrictions and fluid intake and nutritional changes that we need to put into place. Provide safe mobility, therapeutic communication, reality orientation when necessary. Of course, if they're advancing in their dementia and Alzheimer's, you do not reorient. You might provide them with socialization therapies. And of course, where possible, you want to encourage family support.